Viewers, Assalamu alaikum. Today we will be talking about blueprinting of current Pharm D curriculum and clinical pharmacy practices. What is way forward for a country like Pakistan? And being a tutor in clinical pharmacy for more than 8 years and pharmacology and therapeutics at University of Malakand and currently working as professor of pharmacology, uh, it is imperative to understand the current Pharm D curriculum because until and unless we don't know critically review the Pharm D curriculum, then we cannot recommend the revision. Thus, what is important? Important is to understand the current Pharm D curriculum for reforms. So my presentation activity and will be based on blueprinting of current Pharm D curriculum and some phrases about the clinical pharmacy practices and where do we stand and what is way forward. And at the end, it will be presented as summary. Uh, it is better to differentiate between traditional pharmacy practices in the clinical pharmacy and of course the pharmaceutical care units. For better understanding, you can go and open Sharjeel, a textbook of comprehensive pharmacy review by Sharjeel, and that is well differentiated. Traditional pharmacy mean traditional pharmacy like working in community pharmacy or in retail pharmacy with pharmaceutical units. In case of pharmaceutical care unit, where direct data is being fed from the patients and the pharmacist is a key role, playing a key role in the healthcare system, where inputs have been taken from the patients and they help in designing the individualized patient pharmaceutical care plans, and thus they review and revise the pharmaceutical care plan for individualized pharmacotherapy like it is in technologically advanced countries. And of course clinical pharmacy, it's not necessary that in case of clinical pharmacy the patient should be in front of you. Patient profile chart may be in front of you and you get the information, whereas in pharmaceutical care unit you directly interview the patient and then you revise the pharmaceutical care plan for individualized pharmacotherapy plan. Now, what is clinical pharmacy? Clinical means something around the bed, so it's related to the observation and treatment of the actual patient rather than theoretical, uh, theoretically considering the patient profile or the laboratory studies. Thus, clinical medicine and clinical pharmacy are primarily focused on ultimate pharmacotherapy plan, and sometimes there may not be pharmacotherapy plan and some other intervention like surgical intervention may be needed. So clinical medicine and clinical pharmacy go side by side. Thus, clinical pharmacy is the branch of pharmacy in which pharmacists provide patient care that optimizes the use of medication and promote health, wellness, and disease prevention. So recall WHO health definitions that health is uh, state of complete physical and mental well-being and not merely the absence of disease or infirmity. Thus, pharmacy practices related to the clinical pharmacy practices is patient oriented and it relates with knowledge of disease, laboratory interpretation, communications with patient, outcomes monitoring, or best terminology will be the pharmacotherapy outcome monitoring skills, and then the physical assessment, of course, drug information skills, therapeutic drug planning, and then the therapeutic planning skills, revising the pharmaceutical care unit therapy plan for the patient, and non-drug therapy skills as well. So thus it's a comprehensive unit, pharmaceutical care unit, which is focusing on the patient care plan. Thus, regarding blueprinting of the current Pharm D curriculum that is in practice in Pakistan, so if you go on to the learning word is used 4 times, and outcome is used 2 times, and the pharmacy objective, there are 18 objectives, and the evaluation word is used 22 times, and assessment is used at times, but this assessment is used in other contexts, like not in the case of in the context of examination, but rather it is used in the clinical pharmacy setup. So uh, uh, this is very alarming situation. No methods and no method for assessment and evaluation have been there in the current Pharm D curriculum. And remember, curriculum always tells us that how the graduate to be assessed and to be examined for their competencies, targeted competencies. Where is the vision of the statement of the program? So you cannot find a vision of the program for the current Pharm D curriculum. So these are the objective of Pharm D curriculum that I have taken some screenshots. And interestingly, these objectives are not smart, but rather they are some recommendations. And I carry you to some of the screenshot, that is to prepare the student to fulfill the industrial need, and they should be well versed with basic medical and pharmaceutical sciences, and then to prepare dosage regimen for an individual patient. Community pharmacy practice should be comprehensive. This is just like a recommendation, you see. Intensive of various disciplinary should be implemented. Again, a recommendation. These are not objectives, even not smart objectives. And to make the graduate more skillful, competitive, knowledgeable, both practically and theoretically. Again. So tell me, I cannot find smart objectives, though this is listed in the current Pharm D curriculum. This is again uniformity of the curriculum. It's mentioning towards a problem, but it's not giving solution to the problem. So is the case for the this is like the syllabi should be more practical and theoretical as well, and this includes things regarding OTC pharmacy. Again, it seems to be recommendations, you see, and these are not smart objectives. You can find it to bring the uniformity in the context of syllabi and to produce graduate to meet the challenges of 21st century healthcare problems. To some extent, it can be an objective, but still it is not a smart objective. So what is the message? The message is you cannot find competency, even a single word of competency. And you know the competency is the ability of a person to perform certain tasks independently and efficiently. They are focusing on that 1 year residency program should be in the public or private hospital or pharmaceutical industry, and the pharmaceutical marketing research and development and a public by recognized by the Pharmacy Council of Pakistan. But this is a very clean sweeping statement until and unless we don't provide the assessing environment, because at the end of the course there is a certain credit hour of 100 marks, and that is to be assessed and to be marked. The student is to be graded, and how it is to be graded is not there is no procedure for that. Thus the students or the graduates to be graduated, the student to be graduated are not assessed in true clinical environment or in true pharmaceutical industry environment, or as the case may be. Thus there is drastic need for reforms in the curriculum, as it's not focusing on research. And where is the function of pharmacist? That's still not found in the curriculum. What is the world looking for? The world is looking for not only the objectives, but looking for the outcomes and of course the competencies. But unfortunately, there is not a single word of competency in the whole Pharm D curriculum. But nowadays, the third generation curriculum, the word is targeting on outcome based curriculum, so that it shall have a trickle down effect. And above all, for an outcome based curriculum, it should be assessed in true clinical environment, whether if it is for the clinical pharmacy or pharmaceutical care plan unit, or it is to be assessed in true working environment like pharmaceutical industry, where the student is going to prepare some pharmaceutical products like syrup, tablets, and capsules. So these are all skills, and skills are assessed at workplace where thus there should be a close liaison between the pharmaceutical industry, the retail pharmacists, and of course the communication skills is to be assessed, and the coding skill is to be assessed, and true environments of the industry or the clinical setup or the retail pharmacy, or as the case may be. This these photos shows the various practices premises of pharmacy profession, and thus we merely assess the students on knowledge base, and we cannot assess the student in true either clinical pharmacy environment or in pharmaceutical industry environment. And of course the affective domain is not assessed. We merely assess their knowledge based on MCQs or long answer question or short answer question, which is a dilemma of this. Thus the learning environment is a key to success. So the environments and the competence go side by sides, and if we are going to focus the affective domain, the skills, the psychomotor skills, and the cognitive domain, then the learning environment is very important. So where is the pharmacist practices? We may be practicing in the community, in the retail, and of course the industry and the hospital as a clinical pharmacist. Thus, it is very imperative that there should be learning opportunity in a very good learning environment and so that the student can excel. As I said, that this outcome-based education model, so it is focusing on the performance or the competencies, and then the EPAs, entrustable professional attributes, and finally it contributes to the professionalisms. So professionalism is a broad terminology, and the word is focusing on that. I'm not going to discuss professionalism in detail. You can go and Google it on the and find the key attributes of professionalism. Thus, what is important? Important is that Luton says that utility is equal to the educational impact multiplied by reliability multiplied by validity and the cost effectiveness of an assessment plan followed by multiplied by the acceptability and feasibility. Thus, assessment is very technical process which we have undermined or ignored in pharmacy professional exam. We have been successful in increasing the assessing environment in medical education, particularly in MBBS, and we are trying for dentistry now in Harvard Medical University, and the PMDC is trying, but the Pharmacy Council has not contributed well. Rather, they are careless about the assessment environment, and so that our student can compete at the international level. This is Miller format for clinical competence, where for the clinical pharmacy students and the clinical medicine students. And you see, what we teach is the knowledge, then the skill, and then the attitude, affective domain. And when the student gets come in the beginning, he is novice, he don't know, so he is being taught, given the knowledge, and this knowledge is assessed on MCQs, and then he knows how, and then he is assessed on MCQ or extended MCQs on scenario based essays, assessment, and or essays or short answer questions. Our examination system is merely related to cognitions, and we don't focus on the behavior of the graduate to be assessed in true clinical environment or in true working environment. Thus, we lack OSCE's objectively structured clinical examination and workplace-based assessment. That is the need of the time. It is only possible once we have a control training environment in the hospitals for the clinical pharmacy in Pakistan. Since pharmacy institutions are not being well equipped with the clinical environments in the teaching hospitals, Therefore, the Pharmacy Council has to come and the government of Pakistan has to come forward and start the practices of the clinical pharmacy. It's not merely increasing the number of posts in the hospital, rather than we have to increase their competencies. And since our curriculum is lacking competencies, and once we will, when the curriculum lacks competency, and of course, that is why it is not assessed at the level of shows and at the level of does. Thus, what is important? Important is that our model curriculum of the Pharm D should have uh, cognitive cognition load of uh, credit hour, so it must give equal importance to the skills, psychomotor domain, and of course at least 50% of the uh, should be credit hour should be given to the affective domain or behaviors, assess the behaviors of the outgoing graduates. This is very important, and this ratio is very important for any professional degree, particularly health related degree. But for unfortunately, we just assess the student at the level of knowledge at the university level, and we are not linked with the teaching hospitals, and perhaps our graduates are not so much clinically competent. So there is a need for the clinical pharmacy practices in Pakistan to 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 to, and proper hierarchy to assist the student at workplace place level, and and they observe them so far their conduct in different clinical environment is concerned. This is a lock and key model that I have taken from perhaps the uh, Australian pharmacy uh, examination board booklet, and they have proposed the key model for the competency standard, setting standard for the competency. But I have modified that slightly. That this one edge is related to the cognition, the other dent is related to psychomotor skills, and the third dent is related to the affective domain. So whether it's your own student that is going to get admission at the College of Pharmacy, or any overseas pharmacist that is going to be to join as an intern, is going to be assessed at registration level exam, and once he is registered, then he is called as a registered pharmacist, and then he is exposed to continuous professional development, job description, professional practices, role exchange, and of course credentialing and annual re-registration system as well. And these are all the points and areas where the pharmacy councils of Pakistan shall focus in, and we are far behind in the developed countries. As I said earlier, that outcome-based curriculum is now focusing on professionalism and competencies. So this is a very important model that I have taken from the ME guide number 14, which is focusing on the outcome-based curriculum for the health professionals. So in 1900 in the university, it was a science-based curriculum, and the scientific curriculum was focusing and attributed at the university-based level. But in the year 2000 and beyond, it is now outcome-based curriculum, and this is outcome-driven, so that it shall have a trickle-down effects, and consequently you get your health professional to contribute to the health education system in the society. In between, there is a problem-solving curriculum was there, and it was as a practice in academic centers. But outcome-based curriculum is practiced in true clinical environment, and it prepares graduates for their own society needs. Thus, this slide represents that if our College of Medicine's medical institutes with MBBS or dental surgery has been taught, and they have their different hierarchy system, you see, these basic sciences in MBBS or medicine, and there is the clinical sciences, and they have the assistant professor, professor, associate professor in the Department of Medicine, Surgery, and Allied, you see, and Medicine and Allied and Basic Sciences. So likely in the manner, in the Pharmacy Institute, College of Pharmacy should have their basic sciences as it have like pharmacology, pathology, microbiology, all these basic sciences are taught as like it is taught in the College of Medicine, and in the clinical sciences, of course, it should be taught in the in the in the in the College of Pharmacy. But the College of Pharmacy should be affiliated like as it is affiliated with the teaching hospital. So what the message is that there should be similar hierarchy in the teaching hospitals for the assistant professor, lecturer, demonstrator, and professor of clinical pharmacy to be settled in the hospital rather than to be settled in the university. And if it is in the university, so it will be adjoint. There should be provision in the legislation to have adjoint to work as a joint faculty, so that the institution rules and regulation shall not pose hindrance to the practices and improve their clinical skills. So it is then possible if we give environment to the clinical pharmacy and Pharm D students uh, within the premises of the hospital, where the registered pharmacist shall have the position of lecturer, demonstrator, associate professor, assistant professor, and full professor of clinical pharmacy. It is possible for the government can think on that to redesignate the already appointed person and give them short training or diploma training or long-term training. They may make a proposal and send the person to develop technologically advanced countries like UK and USA, and then they shall come back. So they must have a long-term strategy and a short-term strategy. And for a short-term strategies, they can send it to the Aga Khan Medical University or Shifa, and then that these trained pharmacists will be redesignated as their financial impact will not be as much, but their professional and competencies will be enhanced. Then they will help in assessment and evaluation of the psychomotor skills in the true clinical environment, because assessment drives learning. So it should be the pharmacy education assessment of clinical competence for the clinical pharmacy should be at par with the medicine and dentistry as it exists, because without uplifting of the clinical pharmacy and the pharmacy practices, it is very difficult to improve the healthcare system. I hope this messages should be clear to the authorities working in the in the in the health sectors, and of course this model can be applied to the industrial segment as well. So merely assessing the student on long question or MCQs will not work, or short answer question. Rather, they should be assessed in true clinical environment as well. Thus, the curriculum should be reviewed by the Congress method, while inviting the uh, experts from the hospital, from the industry, from the other stakeholder communities, and the common citizens, of course, as well. And this Congress method will help in true feedback and revising the curriculum. This is an example of the Kansas University of the United States of America, where they have adopted this Miller pyramid for assessing the the the, the students of the pharmacy uh, program at Kansas School of Pharmacy. So it's possible in Pakistan as well, provided you have skilled faculty and redesignate uh, the existing pharmacists while giving them training to enhance their professional competencies. So, what is our point of view? There is PMDC in medical. There is PMDC. Their curriculum reforms are there. It is competency based. Is continuous professional development should be there by the Pakistan Pharmacy Council, and of course it shall promote research as well. On the analogy of that, like College of Physician and Surgeon is there, there should be Pakistan College of Clinical Pharmacy, which is going to regulate the residency programs in clinical pharmacy in pediatrics, total parental nutrition, internal medicine, surgery, radio pharmacy, and as the case may be, as it exists in the technologically advanced countries like UK and USA. In this regard, mm, we have we being a part of the Khyber Pakhtunkhwa government in the previous once when they were in power in the Khyber Pakhtunkhwa in the previous government, In the year 2016, through a series of workshops in the WHO, we recommended some human resource for health HRH strategic framework for the Khyber Pakhtunkhwa in the year 2016. And one of the recommendation was, after the SWOT analysis that mentioned on page number 21, which says that the output was recruitment needs identified and educated an increased number of posts in all medical and associated health professional, particular disciplines like pharmacy, physiotherapy, epidemiology, and other etc. disciplines. The rationale was that since number of posts currently are not as per the requirement of the population, therefore, it is the need of the time to increase the number of force of skilled human resource. And one of the recommendation was that present finding recommendation of the generation need assessment and the provincial government and educate for increasing the number of posts to all medical, pharmacy, nursing, physiotherapy, and emerging health sciences and allied health professionals as per the standard of requirements of the population per thousand. You see, and one of the recommendation was that pharmacy education should be with health department as per practice in international standards. The provincial government should start clinical pharmacy practices services in the teaching hospitals. Furthermore, a proposal should be established by the government of Khyber Pakhtunkhwa to promote the clinical pharmacy practices as per the practices in technologically advanced countries like UK, USA, and these were the recommendations. So the way forward is for a country like Pakistan that reforms in the curriculum and assessment procedure are the need of the time, particularly a competency-based curriculum is the need of the time. Reforms, and of course in the Pakistan Pharmacy Councils, is the need of the time, because we need skilled person who knows the competencies, who knows outcome-based curriculum, and so that it shall have a trickle-down effect to excel the role, so that the pharmacists shall excel their role in the healthcare system. In revising the current legislation, because there are certain legislation that poses hindrance into the practice of clinical pharmacy in Pakistan, and even in the United Kingdom, the pharmacists have been given the power of prescribing power in certain areas, and it should be promoted on the analogy of UK, because there are other quacks which are going to practice the medicine where they don't deserve to be. And on the analogy of United Kingdom, you see the pharmacist may be given the power of prescription in certain specialized area as it exists in the United Kingdom. Thus there is the need of legislation and for the residency programs on the analogy of American College of Clinical Pharmacy, USA, and there should be Pakistan College of Clinical Pharmacy, like College of Physicians and Surgeons in Pakistan, that will help in framing the necessary legislation to promote the practices of clinical pharmacy in the better interest of the common citizen of the Islamic Republic of Pakistan. Thank you. I hope you understand now our point of